So I'm Dr. Ryan Eschbaugh. I'm a shoulder specialist here at OrthoUnited. I trained my residency in Grandview Hospital in Dayton, Ohio. Subsequently did a shoulder and elbow fellowship at the Cleveland Clinic. So upon completion of my fellowship, we chose Canton, Ohio as our location to settle down and practice for many reasons. We have some family in the area. My wife grew up in North Canton. We wanted to be a part of this community. We were looking for a private practice that was going to offer many different opportunities, and we felt that the Canton area was the perfect fit for us. So as a shoulder and elbow specialist, I treat a wide variety of upper extremity conditions, ranging from rotator cuff disease to shoulder arthritis to fractures about the shoulder and elbow, common conditions in the elbow such as biceps ruptures, triceps ruptures, nerve injuries around the elbow, and most of my practice is focused on shoulder and elbow. So here at OrthoUnited, we offer subspecialists in almost every subspecialty of orthopedics. That helps the patient in many ways, especially if they come to see me for a shoulder problem and I take care of their shoulder, then they subsequently may see one of my partners for their knee injury or their hip arthritis or their carpal tunnel. And really this is a one-stop orthopedic shop for the patient. It makes it much easier for them to not have to go many different locations or places to find orthopedic care. Here at OrthoUnited, we offer many services to the patient where their entire care experience can be in one location, from the initial evaluation to their imaging studies such as x-rays and MRIs, to their physical therapy, maybe as a starting point for their treatment. And if they would need an operation, we also have a surgery center here in-house, and everything is in one location. It's certainly a benefit for the patient to have that opportunity to have everything here in one spot. So when the patient is choosing where to have an operation, the best possible place that they could have a surgery is at a dedicated orthopedic surgery center, so long as they're healthy enough for the operation there and that we offer that service here, which we essentially offer all orthopedic surgeries here as an outpatient now, including total joint arthroplasty. And this gives them the opportunity to come to a center that focuses only on the orthopedic care of the patient. They do everything every day, from perioperative care, pre-surgical evaluation, day of surgery care, post-operative phone calls. They know how to treat common issues that arise after an operation, and they work together every day to care for the orthopedic patient. It's almost like a family at the surgery center. And so you're going to be cared for at the surgery center as you would be cared for by a family member. One of the things I like most about working here at OrthoUnited is being able to evaluate patients many different ages and oftentimes multi-generational. People often will establish care with me for their shoulder or for their elbow, and then subsequently their young son might get injured on the football field, and that patient then comes to see me for his shoulder. Or their mother may get injured, maybe she fell and broke her arm, and they come to see me. And I think people just really have a comfort level with, once they establish care and they walk in our doors and they have an experience, that they want to come back and they feel comfortable giving their loved ones that experience as well. And we really pride ourselves in being able to take care of people like we would our family members, and we want those referrals from people who come back again and again and again. Not that we want them to get injured all the time, but we want them to have the trust in us to be able to care for their entire family. So one of the things that's special about this practice in OrthoUnited is that many of our physicians take time out of their busy schedules and lives to volunteer their time in the community, at the local high schools, serving as team physicians. And I'm lucky enough to be involved with the Jackson High School here in town. I'm their team physician. That includes providing care for their athletes throughout the year. We're on the sidelines of the football games on Friday nights. We get to be involved with the community that way. We get to know these athletes, their parents, the coaches, and these are the same people that I might go out to the grocery store and see there, or see at a practice of my daughters. And it's important to me to be involved in the community, and occasionally you'll get a phone call or a text message of, hey, having a lot of problem with my shoulder or my knee or whatever it might be. I can't do these things I want to do. And being able to get that person to the office, have them evaluated, making a treatment plan, and subsequently seeing that plan work and getting them back to the activities that they want to do and the lifestyle that they want to live is the most satisfying thing that I get in my job. And so we're very proud to be a part of this community. We're proud to be a part of this practice, and it's something that I'm very thankful for every day.